Hi, everyone. It's great to be here. We wanted to get on and talk to you today about determining and getting to the root of some issues or difficulties you might be experiencing with yourself or with your child or student. So we want to talk about diagnoses or having a suspicion of a diagnosis or thinking that you or your child may be suffering with a learning issue, an academic issue, some kind of behavioral issue that's out there. And what we've learned in our experience is that so many times when this occurs, you will Google, you will search, you will start gathering your information from podcasts, from your friends, from your doctors. And there's a lot of information out there. There's so much information that we don't really know what's verified, what's evidence-based, what really applies to us. Your friend might tell you, this worked for me, this medication worked for me, this therapy worked for me. And it can be extremely, extremely overwhelming for many, many folks out there. So one of the things we like to consider and to give you some ideas is to determine how can you sort through that information and come to a way of deciding what will be the best route for you and what you're dealing with.
Another thing that we want to talk about a little bit more is the fact that sometimes we start doing different treatment methods or we look into techniques that we think are going to help us, but we don't get lasting results. And many times it's because we haven't gone far back enough at looking at the root cause of an issue, particularly looking at a child's or your own development. So the way that you can do that is, for example, if someone gets a diagnosis of dyslexia, and we know that there are reading and writing issues over there, it's not just about the fact that they can't read or write, it's about looking back at how do they reach their developmental milestones. Did they have good balance? Because that's a precursor for those skills. Looking at their self-care activities. As a child, were they having issues with feeding? Were they having issues with sleeping, with their regulation, which is managing their emotions? Many times, issues in those areas can determine that there are root cause issues that are really affecting the reading and the writing. And while we may do other things, we may need to address things from that level. If we're talking about an adult who maybe has executive functioning issues, which has to do with planning something, starting it, finishing it. How many of us procrastinate and we have a hard time starting something, and we can make all the lists in the world and we can have all the techniques and the reminders, but it just doesn't help us as much as we want. Sometimes we need to go back and look at our own regulation or our emotional control, because that may be affecting our ability to really be able to achieve the things that we want to achieve in the way that we do. And even if you are achieving things, sometimes it takes a lot of effort, because we could be high achievers, extremely intellectual and smart, but for some reason, something is holding us back from doing it without a lot of effort.
So again, one of the takeaway tips is that if you're dealing with a diagnosis or a suspicious diagnosis, or you're trying to get through the issues, try and look back on development to try and determine where the root cause may have started. And if you're not familiar with that or you're not really sure about that, our hope is that together we'll be able to learn about development and guide you down this road of figuring out how to get the best treatment and the most practical, most efficient way of getting the help that you personally need.
With that in mind, let us know which diagnosis you are navigating through or which one you suspect you may be dealing with. Reply to this email, DM us, or comment below which are the diagnoses or issues you are currently dealing with, and in our next email to you, we will break down 2 of the most frequently mentioned ones. Let's cut through this noise together. Looking forward to hearing from you.